All right, here we go. Episode 23. We're back in the recording studio, so to speak. Dr. Mike's back in the chair.
Back in the chair.
And how was your road trip?
It's good. It was good. Still kind of catching up on sleep and the backlog of work that happens when you go to town like that. But it was good. Happy to be home. Happy to be back. Happy to be applying what I've learned.
So last week we talked a little bit about the pursuit of excellence and chasing down skills and improving and getting better. Before that, we were talking about your most recent back irritation, if we put it that way. I've had my fair share of that as well. I've had my fair share of back pain, back irritations, and that's progressed far beyond that as well. So we thought that today, let's unpack that a little bit, go back over that history. Talk a little bit about that, put it out there, and maybe someone will find it interesting.
Yeah, I mean, I guess my first question for you is, how long have you had it for? Like, when did it start? When was that moment where you're like, something isn't right? Because I think if we can isolate that moment when you're like, something isn't right, we may be able to catch somebody that's in that phase right now in their joint health journey. And we can kind of show how not taking care of things in the correct way can be quite detrimental. So what was that moment for you when you're like, something's a little funky here?
Yeah, it goes back a fair way. I had to really think about this when I tried to pick apart the history, but there was a couple of really acute incidents. The first one goes back years ago, and it was early in the morning. It was in the gym, and it was kind of, I guess, bending forward a little bit with a couple of dumbbells that were on my knees, and I think I was putting them down on the ground, and it was in that motion of bending forward to put them down, something just went whack. And I'd never experienced back pain before until that moment. And it was that acute and that hard that it just dropped me. And I didn't know what was happening. Like it was pretty scary. I sort of hobbled out of there, walked home as best as I could, lay in bed for a little while. I didn't really know what was happening. I managed to drag myself up to the local pharmacy to get some over-the-counter painkillers, whatever I could do. And, I think I just kind of stayed at home mostly in bed because that was the most comfortable position for a couple of days while it cooled off, which we know is probably not the ideal thing to do. But, I didn't know what was happening. I didn't really have anything to compare it to. I just, I guess colloquially, I sort of thought I'd slipped a disc or something like that. Didn't have any leg pain at that stage, just really, really bad back pain on the left lower back side. It was pretty bad. And I suppose, the biggest thing out of that was I just let it cool off and then got back to doing what I was doing. And that was it.
Right. And we know from, a load versus capacity standpoint that the bending over with the dumbbells was just the straw that broke the camel's back. Like, there are plenty of people that bend over incorrectly with dumbbells. I mean, go to your local gym and see how many people are lifting with incorrect form that don't have back pain. We know that there was probably something going on in your lower back from a function standpoint, from a range of motion standpoint, that had you all the way up to that basically, your capacity from a load management standpoint. And you're nice and plump and full in your discs first thing in the morning, which is completely normal given the fact that, you're recumbent all night and those things hydrate really well. And you've got a plump disc in conjunction with some underlying dysfunction, and our event that causes that initial back spasm, that initial disc irritation is the bending over with a less than ideal posture with a pair of heavy dumbbells. So that happened at one point, and it kind of went away because you unloaded it. What happened next? What was the next incident that you kind of felt it in? What's that second progression look like, where it's like, ooh, blew my back out, everything was fine 5 to 7 days later? When did you kind of have that second event where you started to think, maybe something a little bit more ominous is happening?
Yeah, well, with that one, I just kind of went straight back into doing what I was doing, and I was actually working in an office environment at the time. So I was slouched in a chair for probably 7 or 8 solid hours a day, and that had been, in years leading up to it as well. So I'm sure that didn't help. But yeah, man, I just went back to exactly what I was doing before, and it was a number of years actually until the next one happened. Um, I'd probably, I'd been training throughout that, and I guess getting fitter and being able to do more. So your capacity kind of goes up. So your volume goes up. And this was 5 years later, the next incident happened, and I was training like a complete dickhead, really. Like I was, multiple days without any rest. There was no thought in the programming. And this time that it happened again, it was actually the second day in a row that I was deadlifting that was reasonably heavy, which is just ridiculous. And it was a barbell deadlift. It was, I think, 130 or so kilos for reps. It wasn't crazy, but it was more than enough. And I remember exactly what happened. It was on the way back down again, and it was like I got shot in the back. It hit so hard, and again, it just dropped me. And I was just laying on the ground and trying to sort of just move my pelvis a little bit to try and find somewhere where the pain wasn't as excruciating. But again, I didn't have leg pain at that stage, so it was pretty central. But it was bad. It was pretty incapacitating.
Worse than the first time?
About the same, yeah.
About the same.
I think, yeah.
Got it.
But it was pretty bad. I don't know. I'm a bit of a pussy for pain, I think. But
yeah, and it's hard to tell how bad one bad event is from another bad. I mean, if you ask anybody with lower back pain, the last time that they did it always seems like the worst, and the first time that they did it always seems like the worst. So we know, right? You had this irritating event that happened first. You let the inflammation cool down, and you didn't necessarily improve the function of your lower back at all.
Correct.
So let's say that you had a C grade lower back when the pain initially started to happen, right? You irritate it, you don't do anything about it, the pain goes away, you think you're in good shape. When in reality, right, that painful event probably brought your function down to a D grade, right? And the tissues around your lower back are getting stronger. You're able to push the load a little bit more in your CrossFit workouts. But really, everything around you is getting stronger, but the function of your lower back is getting worse. So now you've left yourself exposed to another terrible event. And you may have subconsciously been managing your load well enough in that 5-year gap to where you weren't getting it every couple of months. Like some people do, right? Some people get it every couple of months because the load that their back needs to experience in order to have that event is just sitting down. And it's like, you can't really change that. You had that event that first time, and you're probably like, I'm going to make sure my back is nice and straight when I'm picking up the laundry basket. I'm not going to put the dumbbells down like an idiot. I'm going to try to do things with good form. And so good form is preventive from an injury standpoint because it's the position of least load on your spine. It's not going to bulletproof you from injury if your dysfunction sucks. So, you hurt yourself, you make things worse, you become a little bit more conscious, you subconsciously then unload that structure every time that you're moving. And it's not till 5 years where you have that event where that back just blows out again. What happens next?
Yeah, well, actually, just thinking about it now, in between those two like major events, there was a couple of minor ones, but they weren't really involving pain. It was more like, I guess, protective spasm kind of stuff going on.
Yeah,
that happened. I remember that was kettlebell swings and overhead squats as well, because my movement was really poor at that stage. And
sure.
so I remember that happening, but and that was kind of like a bit of a warning system as well. But at this stage, none of this stuff had any relevance to me in terms of what it actually meant. In hindsight now, it all is extremely relevant, but at the time, it just didn't mean enough, I suppose. And after that second event, the way that I dealt with that was that this was on a Saturday. So we kind of found a local general practitioner that was open, and kind of staggered in there. I got a lift there and, hobbled my body in there and went into his office, and he told me I was an idiot and prescribed me with some pretty heavy painkillers, and it was like diclofenac. It's like an anti-inflammatory, a pretty powerful one. So I went home that night. The rugby was on. I remember Australia was playing New Zealand. I was, looking forward to watching that. And I got dosed up on these pills and felt pretty good. And I thought, this is great. I feel really good. And the next day I felt better. I thought, wow, I've got away with this. This is great. And, it was probably 48 hours later, I was back in the gym. What a dickhead.
Yeah, I mean, it's not your fault though,
right?
That's the
it
big
is,
trouble.
I mean,
You went to a GP, called you an idiot, prescribed you some strong anti-inflammatory medication without a real understanding of what was going on with your system. I mean, if you really thought you were an idiot, and he knew what he was talking about, what he would have done was say, take it easy for a couple of days. I'm not going to give you anything. I'm going to make you feel every fucking second of this, every ounce of pain, because it's going to actually teach you to not be an idiot, instead of prescribing you an anti-inflammatory drug, which drives that inflammation down without fixing anything, and then enables you to be an even bigger idiot. Right. So again, in your mind, you're thinking, this is great, right? Anybody goes to the hospital, they get a steroid injection, they get an epidural, they get heat and stim to a certain degree. They load up on Tylenol. This is great, right? You're actually creating a more dangerous environment than if you were to just relax for a few days and feel it. We don't want to get too crazy in here and say you just got to feel every bit of it. But that's really what you have to do in that case, because it's your body sending you a signal that something's not right. And you may not specifically know it's not right, but in the back of your head, you're like, this already happened. This is just going to be a thing for me. I know something's not wrong, right? So let's go get it fixed. And in your mind, you think, I go to the doctor tells me to stop being an idiot, gives me a pill, and I think it's fixed.
Yeah. And that second incident there, I never really came back from that. There was a huge loss of power in everything that I used to be able to do. So like my back squat never recovered for that. And at the time I never really understood why. I just always felt like I was kind of weak through there. Everything just kind of went downhill, and I thought it was because, I'd played with some diets and things at the time. I thought, I've lost a couple of kilos, I must have lost all my power, kind of thing. I never really put it down to the fact that my back was so badly injured, because I wasn't in pain. But, that was the last time that I had that really heavy, acute kind of incident. From after that, it was all kind of insidious, I guess. It was a bit more in what you talked about, where you kind of would stand up a back squat and kind of go, oh shit, that doesn't feel right. That was more what I would start to get from that point on. So I'd load it and tip it over that threshold, and then I'd just kind of get muscle guarding, and maybe a couple of days later I'd get really sore, and I'd start getting referral over the SI joint, and I'd get that adjusted, and I'd get sort of glute pain, and so I'd be smashing that with lacrosse balls, and doing everything around it, but not understanding where any of this was coming from. And it wasn't for lack of trying. I did, go out and seek help with that. But it was more, I guess, sort of symptomatic kind of relief in most of those cases. So yeah, there was episodes that would happen where I'd get back pain now, but it was more that it would kind of come on slowly. Those big bolts that would sort of drop you to the floor, that was kind of done by that stage. And so now it was going to be sort of like it'd creep up on you kind of thing. And then that would get bad, and you'd be dealing with that for a couple of weeks.
When did you start to feel symptoms down your leg? Like legitimate symptoms, not just sclerotogenous pain, like actual, oh shit, something's touching my nerve.
Yeah. In hindsight, I think it had already been there a little bit. I just hadn't connected the dots yet.
With the weakness, right? And you know when the weakness is there, you're
Yeah.
royally screwed, right? Because weakness usually happens when it's bad, and like weakness is not a first level or a first order sign of a space occupying lesion, right? Touching a nerve root. Weakness is the second thing that happens. Weakness is there's no chance we get to fix this conservatively, and you need a laminectomy and a discectomy.
Yeah. It was another couple of years after the last bad incident. And I'd had sort of bouts of pain in between that, but at that point, yeah, no leg involvement, but some really, really like bad bouts of pain, but they were coming on sort of insidiously. But yeah, in hindsight, I remember it was like wintertime, and I pull on my track pants, and the last thing you kind of do at the end of the leg is you pull your big toe through. And I remember feeling tingling in my big toe as it had popped through, and just not really paying much attention to that, at the time. But in hindsight, we know what that's about. And the other thing was that the outside of the foot on the same leg would get numb. And again, it was sort of in wintertime, and I didn't pay much attention to it. I put it down to I was cold.
Like I need better socks. My socks will help me with this numbness.
Yeah. Yeah. So, the signs were there. And at that stage, I hadn't put it together. And then, in between these bouts of pretty bad pain, I had sort of developed a bit of a limp at one stage as well. My walking had changed for periods of time. And I just thought I was jammed up in the pelvis. I just thought I needed to get that thing adjusted because I couldn't swing my leg through. Like, that was how I was kind of making sense of that to myself.
You had a leg length discrepancy and you just needed your PI ileum adjusted.
Yeah, more or less. That's kind of what I put it down to. But at that stage, yeah, I was having trouble actually pushing off the ground. My plantar flexion was weak. So, those signs were there before the big fallout happened, but they would come and go, I guess. So as that, there was obviously some sort of hard compression that was happening, but it wasn't quite at the stage yet where it was just full blown compression. It was kind of coming on and off a little bit.
Yeah, there's a huge lesson there from, I mean, this may be too clinical for the average person listening to this, but it's important to know when you have actual physical compression of a nerve root, what you will see is symptoms start to develop distally. And then as they get worse and worse and worse, they'll start to go proximally. So in Chris's case, as that nerve root started to be compressed by that disc, he started to feel it in his toes, started to feel it in his foot. As that started to progress, in most people, and I don't know if this is one-to-one with your experience, starts to creep up your calf, starts to creep up into your knee. You very rarely get like a purely dermatologic distribution of numbness, right? So meaning what you would find in a textbook. It starts at the extremities, the very tips of your body, and starts to work your way up. When it's inflammation that is touching a nerve root, so not necessarily a solid physical space occupying lesion, but you've irritated something, there is inflammation at that area, and that inflammation, that liquid, that gel of substances touching your nerve root, it's going to happen proximally. So you're looking at SI joint pain referral, you're looking at glute referral, you're looking at stuff like that. So very rarely are you getting a purely dermatological pain distribution. If it's chemical, it's traditionally going to happen proximally. If it's actually space occupying, it's going to happen distally.
Yeah, you're right. That's exactly how it sort of felt. And then the big fallout where all of this kind of came crashing down was, again, it didn't really have an event tied to it, but I remember it pretty clearly. I was at the university, I was in the library, and I just got this feeling of it was like this big sort of radiation through my butt. And I thought, okay, that's kind of weird. And then it sort of slowly was moving down the back of my leg. It wasn't pain. It was just like this big kind of, it wasn't, yeah, it's really hard to describe. Not like a really sharp electricity. It was just like this big kind of radiation sort of sensation. It was really uncomfortable, but it wasn't painful. And it was slowly moving down my leg. And I'd sort of try to move and stretch it out and walk it out, and wasn't going away. And then it got to the back of my knee and it was really uncomfortable. And it was just kind of slowly working its way down. And this was happening over the course of a couple of hours. And there was sort of like muscle twitching going on in my butt. And it kind of got all the way down to my lower leg and my foot. And I was so uncomfortable that I tried to go and walk. I just sort of went out of the library and tried to walk. And we've got a large staircase to get up out of the library. And I was trying to get up there and I realized I was having trouble actually just walking. But I'd sort of had this problem with walking a little bit. So it wasn't too unusual, but it was getting a lot worse. And as I got outside and tried to walk this out around the courtyard, I realized that, man, I actually really can't walk right now. I was almost kind of dragging this leg. So I went and grabbed my stuff, and, this is at the end of the day on a Friday. I'm like, shit, I don't know what I'm going to do. I went to get on the train to go home, and you go down the platform again, there's a lot of stairs because it's underground, and my foot was just like slamming into the steps on the way down. I couldn't kind of control it. So I got downstairs. I thought, okay, I think I'm actually weak here. So I tried to stand up on my toes on that leg, tried to plantar flex, and it just didn't move. So I was looking down at it and like willing it with everything I had to try and move, and it just didn't budge. And it was kind of scary, like
it's a weird thing to experience.
Completely. One of the first things that I thought about as well at that stage was like, what would it be like for someone with a bigger injury? Because that feeling of trying everything you can, like from a nervous system level, to try and execute this movement and just seeing nothing happen. Yeah, I've never experienced that before. I hope I never experience it again. It was really, really weird.
It's a bizarre, like if you're listening and you really want to try to figure that out, like sit on your hand for like 20 minutes and then take your hand out and see if you can like move your fingers. It's not going to be nearly the same. Like, you're going to be able to do it after a few seconds, but that's what that sensation feels like. You're like, my hand is here. I recognize my hand, but my hand doesn't move. And that's about as clear cut of a surgical case as it gets. If you go into anybody's office and you're experiencing lasting neurological symptoms, even if you're experiencing intermittent neurological symptoms, so things like true weakness, things like true sensation loss, it's surgical. Like, you got to get cut open for that. And in a perfect world, you're feeling your back slip disc that first time, like Chris did when he's bending over on the dumbbells, and you're going, okay, this is the path that I'm going down, right? I've listened to this story. I've listened to the way that, I handled it. I listened to the way that you handle it and said, yeah, let's go get some treatment. So we don't get to the point where you're you and you need, spoiler alert, you had surgery. Sorry, I ruined the surprise. But it's not a surprise for anybody that knows anything, right, about medicine.
Yeah.
But yeah, there's nothing you can do at that point except surgery. So figure it out before it gets to that point.
Yeah. And it had to happen quickly from that point. Like after I was at that point, I got off the train, sort of hobbled to my car, and I've got a car with a clutch, so I couldn't even push the clutch in to get my car home. I was like bunny hopping and stalling it everywhere. It was scary as shit. I got home late on a Friday night, and it's just like, what do you do? I kind of, just waited it out for the next morning. Nothing changed. And ended up in hospital, went through emergency. They did all the triaging and testing, and was there for hours, had to have a, full neurological assessment. They were concerned enough that imaging was next. So they had an X-ray and then an MRI, and I just sort of heard, as they were reviewing the images, I heard something about a gigantic extrusion. And my pain was gone by that stage too. So it had progressed so much that the pain was gone, but the neurological stuff was going nowhere. So yeah, I was just, I felt okay at that stage. I wasn't in pain. I was just kind of hanging out in the hospital, waiting to see what was going to happen. The ortho guys came down and showed me the images, and, it was pretty clear that there's something very wrong here. So they wanted to operate very quickly. It ended up being in the next, I think it was 24, 48 hours by the time I actually got in there. So, there wasn't too much mucking around, because it needed to happen to get the best result possible. So at that stage, the weakness was there. There was a lot of loss of sensation in that leg, which hasn't come back. We're talking about nearly 3 years later, and that skin is essentially dead. You can't feel anything. So that's not going to change. Most of the strength has come back, which is great. But yeah, had to get cut open, had to go through that process of knowing that someone is going to take a scalpel to my spine. They're going to cut bone away from the vertebra.
Not just a scalpel, a saw too.
Yeah.
You can't forget about that stainless steel circular saw that looks like it's out of a video game. They're just like, zzz,
yeah.
zzz.
And I've got a photograph of the material that they removed from my spinal canal, and it's gigantic. It's over 4 centimeters long.
Jesus.
Yeah, really, it was pretty bad. So, you kind of wake up, you go into that. I remember going down there and just kind of, you just hope, you just have to roll with it, but you just hope that it's going to go well, because, there have been cases where people don't get a good result, that something goes wrong, that nerve root gets injured, and that's something that you can't come back from in terms of that function. So,
in your case though, I would be like, unless there's an actual surgical mistake.
That's right.
Like unless somebody messes something up from a surgical standpoint, that's about as clear cut as, a differentiation between how you feel when they put the anesthesia on you and how you feel when you wake up. Like, you're going to feel a difference. Yes. Right? Because they're taking that thing out of you. Now, the person that's got a history of back pain, and it may be caused by something that's not an actual space occupying lesion on their nerve root, perhaps spinal compression secondary to adhesion, you may have surgery and you may wake up and say, that's a little better. Only a little better. Right. So that's the big lesson. The big lesson here is get it taken care of early. Right. And the importance of having a diagnosis, even from a traditional Western medical standpoint. Like, they needed to know exactly what to do. They had it. You had an extrusion. They knew how to fix the extrusion. They executed that fix of the extrusion in a wonderfully efficient and perfectly accurate way. We just need that level of precision and accuracy at the beginning of your back situation, right? We needed that from day one. Somebody needed to look at you and say, you have 70% back function. There's mild adhesion in your supraspinous ligament, mild adhesion bilaterally, a little bit more on the left side in your lumbar erectors. And we're going to remove that, and we're going to tangibly and measurably improve your back function. That's what was missing from this story from the get-go. And it costs you back surgery, right? Like, I'm sure it pisses you off being in your state right now, knowing what you know now, that somebody could have just given you a better understanding. Somebody should have said, hey, you got to go to my guy. After that first one, after that second one, when you went to the GP and they gave you the functional equivalent of ibuprofen on steroids, pun intended. He should have known. She should have known. Whomever. That person's got to have a fundamental understanding of what happens, because they're dealing with the greatest limiter of work, the greatest burden on any healthcare system, on any country on the planet, and they don't know. They just don't know. Don't be an idiot. Here's an anti-inflammatory and Saya the fuck Nara. But what they really did was they said Saya the fuck Nara to your back by doing that, by not having an understanding what's going on. It wasn't until you had surgery that the orthopedists actually gave you a real diagnosis. And it was only a diagnosis at that snapshot in time, but it was a diagnosis that was real and that there was an intervention directed towards that diagnosis to actually fix it.
Yeah, and there's two things, I suppose. So having had the surgery and coming back from that, the functional deficits that led up to that point essentially still there. Now they're worse, right? You know, sciatic nerve entrapment was a problem for me. That was still there and untreated. And now we've got a whole lot of scar tissue that we're dealing with. And those lumbar segments are moving even less than they did before in healing from the surgery. The other thing, you know, reflecting back on that, I see the whole thing as a gift, honestly. And it doesn't piss me off. I think the only part of it that does piss me off is that, yes, it should have been caught earlier. And yes, in a perfect world, we should have been able to avoid it. But if I had avoided that, we probably wouldn't be having this. We wouldn't be having this conversation, but we may not have had any of these conversations ever. You know, not to sound like a martyr or something, but, you know, this was important for me to go through to be able to help other people not go through it. And I learned so much out of it and got so much out of it. You know, it was actually my wonderful partner, Vera. It was actually when I was in the hospital recovering from surgery is when she came in to visit, and we've been together ever since. So that's, yeah, right.
Yeah.
So that was a big deal. But, you know, what I learned from having gone through that process, everything that I've observed in myself and all the mistakes that I've made, you know, that's burned so far into my brain that it helps me to be able to help others now. So, you know, not to sound like some fucking martyr or anything, but I think
you've got to deal with it. You've got to process it.
Yeah.
I mean, yeah, you've got to process it. I'll be pissed off for you because it's not a weight that hangs heavy on me, but if you were still pissed about it, it'd probably weigh heavy on you. So it's best if you just let me be pissed about it. And then you just get over it, live your life, say no regrets, taught you a lot of valuable lessons. In my head, I'm like, you probably could have learned those lessons in a way that didn't involve a scalpel and a bone saw, but hey,
yeah. And
to each their own.
Coming back from that surgery, you know, the neural compression that we talked about, that was gone, right? So started to get some strength back, started to feel better in that sense. But the actual function of my low back was a complete disaster. And I had probably more back pain in the months that followed the surgery than I had in the months leading up to it. Like it really made a mess in the sense that the tissues there are just, they have to heal. And, you know, we know that they like to heal in a strong way. They lay down a lot of collagen and stuff. That was a nightmare. That was, you know, that involved a lot of anti-inflammatories, a lot of just trying to get by, really, a lot of modification of activity, a lot of frustration, a lot of kind of questioning, did I even need to do that?
Yes.
Yes. Yeah, 100%. But, you know, you don't feel a lot better, right? So you're just kind of going, why did I do this? You know, thankfully I've got the use of my leg, which is a good thing.
That's why.
Yeah, exactly. But yeah, look, and it wasn't until probably 18 months after that, you know, I linked up with Dr. Marcus, and he started working through these functional deficits in the tissues and actually undoing some of the stuff that was there from years ago, but then undoing some of the stuff that had been added through the surgery, and things started to feel better. And that was, for me, you know, that was a big deal. That was quite eye-opening. So again, if I'd not been able to go through this, you know, I wouldn't have learned these lessons. And so I'm grateful for it all. But yeah, it's been a big part of my life, you know. So that's, I guess that's why I'm passionate about helping people with that now, because it's a big problem. And, you know, I've just finished doing an assignment for uni at the moment, and the statistics are that at least 85% of the global population experiences back pain. And, we've just talked about how it can progress. And this is kind of an extreme case. A lot of people won't experience this progression, but some of them will. And we could have caught it earlier. So there you go. That's my back pain 101.
That seems like a great place to wrap it up.
Yes, let's do it. I've talked too much today.
We've talked. We set out to do a short one, and I think we did a pretty average to above average length podcast here. But sometimes when the coffee gets rolling, can't shut us down.
There you go. Two bald men with coffee and microphones. You never know what's going to happen.
Dangerous. All right, guys. Have an awesome week. We'll talk to you soon.